Hi, welcome to Opinions on the Fly with me, Tyler. Today I'll be tying a steelhead attractant fly and at the same time expressing my personal opinion on something that's a pretty hot topic in the media over the past couple days. Our Prime Minister, Justin Trudeau, and our Federal Health Minister have expressed some interesting opinions on the unvaccinated people. Justin Trudeau referencing most unvaccinated people to racists and idiots because they won't go and get their vaccinations. Federal Health Minister has expressed his personal opinion regarding the matter of charging Canadians a financial penalty for not being vaccinated, due to the elaborate cost and overtaxation of our medical system. He says that our medical system is failing due to the unvaccinated people. I could get more on board with charging unvaccinated people if the vaccine truly did what the manufacturers and what our government has claimed that it would do. Remember when it claimed that if you got the vaccine, it would protect you from getting the virus. If you got the vaccine, it would protect you from transferring the virus to your family, to your loved ones, to your friends, and to the community. You remember when they said if you get the vaccine, everything will go back to normal. We only need 80% of Canada, of eligible adults, to be vaccinated for the pandemic to end. Well, as of the statistics yesterday, federal statistics indicated that 87% of eligible Canadians over the age of 12 have been vaccinated. That essentially says that only 10% of Canadians over the age of 12 are unvaccinated. This is greatly improved from 2020 and 2021, and yet we are in the worst crisis of the pandemic related to COVID-19. So if the vaccine was truly going to correct and solve our problems, again, I would be on board with getting the last 10% vaccinated. But as an international traveler, I have seen firsthand, being vaccinated myself, that it doesn't actually stop you from getting COVID. It doesn't also stop you from transferring COVID. The only thing that the vaccine might do is it might stop severity of the COVID virus if you come down with it yourself. My problem is that if we're pushing this narrative that everybody has to be vaccinated, vaccinate, to the point that we're actually separating family members, separating friends groups, separating the country over the issue, and our Prime Minister can go on public media, TV, and call a certain type of people or a certain status of people idiots because they aren't vaccinated. That indeed is a very strange and troubling time. The idea that we should financially charge these people that aren't getting vaccinated because it's ailing our healthcare system is also troubling, and that's what I'd like to spend a couple minutes discussing. When a government can financially charge you over medical issues or medical beliefs, that's no longer a democracy, that's a dictatorship. When the government decides that you are non-compliant to something that they truly believe in, and they can financially charge you for that, you're no longer allowed to have an opinion. You're no longer allowed to have your freedoms, and that to me is troubling. If we go along with this idea of actually financially charging people that are unvaccinated due to the taxation on our healthcare systems, where does it stop? Let me ask you this. Should we then be financially charging all the smokers in Canada? Should we be financially charging them for the amount of time, effort, facilities that are tied up due to smokers and the cancers that it causes, should we then be charging our homeless and street people in downtown Vancouver that we currently pay for their warm shelter, currently pay for their clean drugs to be screened, and currently pay for the clean needles that they use because they are in desperate need of help? Do we now just financially charge anybody that steps out of line? That's what we've kind of seen Canada transitioning to. And although I know today we're only talking about vaccination or unvaccinated people, the scary thought process to me is, where does it stop? Where does it end? But then I thought, you know what? It's Canada. We won't actually financially charge somebody because of a medical status. And then I woke up and read the newspaper and seen that the French premier has indicated that he will be implementing a financial charge to Quebecois people who are unvaccinated. I can't honestly believe that I live in a time in Canada where the government is legally and morally and ethically inept to believe that that is a good idea. I truly believe that we should caution any person that says that we should be financially charging Canadians as a whole for anything that affects them on a personal level. And when I say that, although yes, there are certain electives, surgeries, cancer treatments and such that may not be being completed due to COVID, but our healthcare system has been overrun for many years, and it's not due to COVID. Our healthcare system, if you talk to anybody that was part of it, nurses, doctors, emergency responders that worked on the ambulances, they would tell you that our healthcare system was indeed in trouble long before COVID-19 came along. People were already missing surgeries. People were already living in hospital beds in hallways. People were already being turned away in the ER room for non-severe emergencies because our hospitals were already at max capacity. This is not a COVID problem. This is a systemic problem across Canada. And my question is, why is the narrative only vaccine, 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 vaccine? We're in year 3 of a pandemic, and everything that they've told us about the vaccine is not true, or at least hasn't come to fruition yet. Where's plan B, C, and D? Why haven't we attempted to increase our doctors, our nurses? In fact, we've done the opposite. We've gone backwards, and we've actually forcefully made people quit their jobs and retire. Although if you're vaccinated and you test positive, then it's okay. You can still come to work. Instead, wouldn't it have made more sense to bring awareness and start creating more hospitals, creating more bed spaces, encouraging more students to come out of school and become nurses and doctors and part of our healthcare systems? We've had 3 years to do something like this, and we haven't. All we've done is spend billions and billions of dollars on vaccines that don't work and test kits to tell us that we still have COVID-19 floating around in Canada. But going back to my original thought and my original opinion, and that is, we should not be financially charging any Canadian on a personal health choice. This is wrong on so many levels. That's just my opinion. You can take it or leave it. Thanks for tuning in. I'd love to hear your comments, your thoughts. Feel free to add them below, and I'll answer them as quickly as I can. The fly I tied is a pink and purple steelhead streamer. I'll probably go lose this in the river a little bit later today. So anyways, thanks again for tuning in, and cheers, Mech.